You might notice extreme thirst, frequent trips to the bathroom, or unexplained weight loss. Maybe it's constant fatigue, blurry vision, or a strange tingling in your hands and feet. These aren't random aches and pains. They are a coordinated distress signal. They indicate that your bloodstream is overloaded with sugar, and that excess sugar is actively damaging your internal organs. Normally, cells need glucose for fuel, but cannot absorb it directly. They require insulin to unlock cell receptors, permitting sugar to enter. Diabetes occurs when this signaling fails. Whether insulin is missing or receptors ignore it, glucose remains stranded in the bloodstream. Knowing that the signaling has failed is only the start. Determining exactly how and where the process broke down is the only way doctors can categorize the disease and map out a patient's medical future. The first type of breakdown is a total production failure. In type 1 diabetes, the body's own immune system makes a critical error, attacking and destroying the insulin-producing cells in the pancreas. This results in a total shutdown of production, leaving the bloodstream entirely devoid of the hormone needed to move sugar into cells. Right now, medical science has no way to prevent this autoimmune response. It most frequently strikes children and young adults, though it can appear at any age. Because the body can no longer manufacture its own supply, survival depends on external replacement. Patients rely on continuous insulin injections or a mechanical pump to perform the work the pancreas can no longer do. Type 1 is a non-negotiable mechanical failure. Without external medical intervention, the body simply cannot process energy. The second type of breakdown operates entirely differently. In type 2 diabetes, the pancreas is still manufacturing insulin. However, as you can see in this diagram, the cell's receptors have become resistant to its signal. They effectively ignore the hormone, forcing the sugar to remain in the blood. Historically, doctors saw this utilization failure mostly in adults over age 45. However, modern lifestyle factors, particularly a lack of physical activity and poor diet, are increasingly triggering this resistance in much younger demographics. Because the pancreas is still working, doctors can attack type 2 from multiple angles. Treatment often begins with dietary changes and regular exercise, progressing to oral medications and occasionally supplemental insulin if the resistance becomes too severe. A type 2 diagnosis offers the patient a high degree of control. Through deliberate daily lifestyle choices, this specific biological failure can often be actively delayed, mitigated, or even prevented. The third type of breakdown is strictly situational. Gestational diabetes develops exclusively during pregnancy, appearing in women who have never had a history of the disease. The culprit here is biological interference. During pregnancy, the placenta produces specific hormones that actively block the mother's normal insulin from working. This temporary resistance carries immediate risks, including abnormally high birth weights for the infant and an increased future risk of the mother developing type 2 diabetes. Fortunately, the hormonal interference typically resolves shortly after delivery. Even though it is temporary, the condition requires strict monitoring and precise dietary management to protect the long-term metabolic health of both the mother and the child. Because all three of these biological failures share the exact same outward physical symptoms, the thirst, the fatigue, the blurry vision, we cannot rely on observation alone. Standard blood tests are the only way to confirm a diagnosis and determine the extent of the failure. This data chart maps out the exact clinical thresholds doctors look for. A positive diagnosis is confirmed if your fasting blood sugar hits 126, an A1C average reaches 6.5%, or an oral glucose tolerance test hits 200 after 2 hours. If your numbers are creeping toward those limits, remember the agency you have in managing type 2 and gestational diabetes. Maintaining a healthy weight, focusing your diet on vegetables and lean proteins, and committing to at least 150 minutes of moderate weekly exercise physically alters how your cells respond to insulin. If you are experiencing unexplained symptoms or need a comprehensive management plan, expert care is available. Reach out to the specialists at Arka Anugraha Hospital, located right here in JP Nagar, Bangalore. A diabetes diagnosis shifts the responsibility of metabolic regulation to your daily choices. Understanding the specific diagnostic markers of your condition allows you to navigate that shift and maintain control over your long-term health.